Cali, welcome to Talking Acromegaly and Pituitary with Tony. I'm extremely excited to have you join me today.
I am very, very happy to be here. Me and my whole family have been watching your podcast and prep for treatment and stuff. And so I'm grateful for what you're doing, and I'm excited to get to talk about my story a little bit. So thank you for having me.
Pleasure is all mine, Cali. You have a phenomenal family, so let's get into it. You mentioned to me in a previous conversation that you're very good at your medical history monologue. I think that's the perfect place to start. Take us through your journey from the very beginning and tell us everything that led you to where you are today.
Yeah. So I think anybody who's a patient knows when they start with a new doctor or specialist, they have that whole script that they run through to make sure they hit all the bullet points. So I can go ahead and walk you through that. So around 19 is when I really started noticing, and for reference, I'm 28 now. Around 19 is when I started noticing hormonal symptoms, things like hyperhidrosis, irregular cycles, things like that. Got in contact with my OBGYN and was diagnosed with PCOS, which is now PMOS. And that was something that they really diagnosed based off symptoms and not as much my imaging, which was pretty standard back then. So I continued on with that diagnosis and kind of managing that with my team. And in January of 2021, I was diagnosed with papillary thyroid cancer. So I had just turned 23, and my gynecologist had palpated a spot on my thyroid and went ahead and sent me off for an ultrasound. That ultrasound indicated the need for a biopsy, and I got my diagnosis in January. I had surgery February of 2021 and then radioactive iodine treatment in March. So it was very quick treatment. I kind of knew the steps. My mom had been diagnosed with papillary thyroid cancer when I was younger. So there was some predictability in that treatment plan, and kind of the timeline for it. I have been seeing an endocrinologist since 2021. I was seeing someone in San Antonio before I had moved to the DC area up in Northern Virginia, and I continued with my endocrinology care. I was seeing a nurse practitioner, and I guess probably early 2025, I started sharing with them that I had been noticing more symptoms that I couldn't really link to the thyroid cancer or the PCOS. So I was sharing with them that my face was swelling. I have noticed a big increase around my eyes and in my cheeks of swelling. I was letting them know that my shoe size had gone up. I had shared that my jaw was shifting. I don't think I was really aware at the time how intense the fatigue and pain was, but I was sharing a little bit of discomfort. And my nurse practitioner, who works through an endocrinologist, didn't ask any follow up questions, continued to kind of link things back to my other diagnoses. And it wasn't until my oldest sister, was Meg and I are both medical nerds. She's a biology teacher, and we have a lot of medical professionals in the family. And it really paid off because she's actually who found the acromegaly diagnosis online. And the same day, I had gone to another OB appointment, OBGYN, and my gynecologist had said, we need to check your prolactin levels. And if they're off, we'll go ahead and check an MRI for a pituitary tumor that she thought may have been secreting prolactin. So it was odd coincidence that the same day I had gotten on the phone with my sister. I was walking my dog. I still remember it. And she said, the symptoms that you've been talking about sharing with your endocrinologist, I was looking into it and I found this diagnosis, acromegaly. And we cut our walk short. I went back to my apartment and got on the phone with Meg, and we were looking through all the symptoms. And I just remember thinking, this has to be it. And then you kind of oscillate between this has to be it and doubt because we're so used to our symptoms not being taken seriously, and you don't want to get your hopes up that maybe you have an answer. So I reached out to my endocrinologist. I had blood work coming up for my thyroid levels and requested that they order my IGF-1. And all of this was through research that I figured out the criteria for diagnosis. And my IGF-1 came back 1,157. And for reference, as you know, the normal range is about 90 to 300. So very elevated. My endocrinologist wanted to go ahead and order the growth hormone tolerance test, which is kind of a dated way of diagnosis, before they ordered my MRI. And then they ordered that test wrong 2 or 3 times. And by the second time, I called the office and was like, I'm not waiting for this MRI anymore. You guys have delayed my care. And so went ahead and advocated for that MRI. And we got the results back on a disc. I say we because I was looking at this with my coworkers after work on a disc reader. And we had pictures pulled up of reference of what a normal MRI would look like of the pituitary gland. And it was very clear that my tumor was very large and invasive just from someone, doing research and looking at that tumor. And so the report came back that the tumor had invaded my cavernous sinus. It had partially wrapped around my carotid arteries on both sides, had encased my optic nerves, and had fractured the bones to my sinuses to push forward into my sinuses. Um, and so I had gone to meet with my endocrinologist, and they had moved me to the doctor. And I showed her the pictures, and she was stunned. And I was very neutral. And she was saying, you must know that this is really serious. And I was like, yes, I know. And she was like, you're very calm. And I was like, well, you just told me my cortisol levels are low. And I had done a lot of processing before meeting with her and that same day. So she diagnosed me. And then I was also diagnosed with diabetes.
Cali, you said a mouthful. You are an absolutely remarkable young woman who is facing and has faced more than most people could ever imagine. Let me mention this for our audience. This is part one of a two-part minimum series with Cali because Cali's story runs so deep. So, your sister played such a significant role in your diagnosis. Meg did a lot of research. You mentioned that the both of you are medical nerds, and despite having an endocrinologist for quite a long time, that endocrinologist did not diagnose your acromegaly.
Yeah. So I think that the really important piece with that is I'm somebody who is plugged into the specialty that should be aware of this rare disorder. So it just kind of goes to show how much the need for awareness and advocacy and medical professionals to continue to educate themselves, because realistically, I'd been showing signs of acromegaly and I had physical presentations of it since I was diagnosed with a papillary thyroid cancer. And so I think my story just shows how somebody who isn't plugged in with endocrinology may go even longer without awareness that they have a brain tumor and that they have acromegaly.
How did you feel when you realized that diagnosis came, in large part because Meg listened and researched?
I think I felt ready to go. I think it felt like game on. I am very and it'll come up a lot this podcast because I think when you're going through something hard, all those good things and supportive people are extra prevalent. But I'm very, very lucky that I have family that cares enough to look into my health concerns and who care to be right there every step of the way with me. Um, but I think because I have that support, I felt equipped to go. When I was diagnosed, I had spoken with my endocrinologist and I said, my support system's in San Antonio. And she was very quick. I said, I really think for this treatment, I need to be back in San Antonio. And she was right there with me and immediately referred me back. And so I think the fact that I have the family that I do and the friends that I do gave me a confidence going into treatment. And I think the history of the cancer also gave me this confidence of knowing that I can handle hard things and knowing that my support system can get me through the days where I don't feel like I can handle hard things.
Mention returning home. You also mentioned in a previous conversation that you and I had that your primary care physician came into the picture after you returned home. Can you go into detail for us about that?
Yeah, so quick shout out to Dr. Cadena and Alex, my nurse at my primary care. We got plugged in with primary care at UT Health once I arrived home, and the comfort and um, I think that they have kept my treatment and the steps of referrals and all of that grounded for me. The ability to know that they're going to refer me and then they're going to find the best person to refer me to and help schedule appointments has taken so much weight off of my plate that's already feels very full. So the service will, and this is a concierge service, and I say that not everybody needs a concierge service. It's just about finding someone who's going to listen to you and view you as a whole person. So they were checking on my psychological health. How are you handling this? They were asking me about my symptoms and referring me to physical therapy at the cancer center here. I'm seeing a psychologist had been at the cancer center, but works with chronically ill patients through UT Health. And so I think the resources that they have access to, they've connected me to, has given me the ability to breathe because I felt for so long I was the one having to really advocate. And when I got to a certain point where I told myself I'm going to advocate for myself like I would for one of my students. Um, and I don't have to do that as much now because my doctor and my nurse at my primary care do that for me. And my whole family loves them. We talk about them and all the things that they do for us. But that would be a huge thing that I would recommend to anybody going through something medically complicated or acromegaly is find your medical people, whether it be an endocrinologist or primary care, who take the steps with you and for you and aren't working against you. That's made all the difference. This is already hard if you are still feeling like you're being gaslit by medical professionals or you feel like the ball is constantly being dropped in doctors' offices, which happens. And we've all experienced it. The people I know who are going through acromegaly can all speak to that. But so that would be a huge thing I would recommend.
Let's take a step back, Callie. You mentioned your students. Explain for our audience your career.
Yeah. So I am a special education teacher at a behavioral center. So we support students age 5 to 22 who have high support need behaviors linked to autism diagnosis. So right now I'm working on my master's degree in applied behavior analysis to be able to further support the population that I work with and hopefully expand that into getting to support teachers one day and things like that. But I I worked at a center where that was all we did, and it was very physical job. Um, Students who had a really hard time maintaining safety for staff and themselves, and you get to go in every day and build relationships and help them feel safe enough to make progress and make mistakes and come back the next day and do better. And I couldn't imagine doing anything else. I think it helps that I'm very tall, and that's not completely linked to the acromegaly. They think that came later, but I'm 6'1", and acromegaly helps with muscle tone. So that definitely helped me be good at my job and helped me support my students. So it has been a huge identity piece for me, and it's been very hard stepping back from that. It's a huge source of confidence to be able to go in and do something that people will tell you again and again they couldn't do. And it's a huge source of meaning to be able to have those connections with students who other people have a hard time connecting with, and their families who I had a very hard time stepping away from my students and their families. And yeah, that's been a big challenge for me and something that I've been having to process with my therapist and try to get over feeling guilty about.
You worked in Virginia and you had to step away from your students to move back home to San Antonio for your health care.
Yes. So my healthcare team, my endocrinologist actually, when she diagnosed me, there were concerns about safety with getting hit in the head, and also the fatigue and brain fog and joint instability and things like that. And my getting treated for my diabetes, I was feeling very sick very often. I was having to step out of class, miss days. I was having very bad reactions. So when I moved home in December for treatment, um, I had to say bye to my kids, and I, had to prep them and prep their families very quickly for a huge change. And that is something that I know is the right call, and it's also been very, very challenging, uh, to give myself permission to take care of myself right now. Um, but I'm getting better at it, and I know a lot of people could feel that way if they're stepping away from a job they love, or they're just used to prioritizing productivity. It's not selfish when you're unhealthy to focus on getting better, and that I'm saying that to myself just as much as I'm saying it to anybody else listening.
I'm so happy that you understand that it isn't unselfish to take care of yourself first. Your tumor is by far the biggest that I have seen. When you saw your tumor and you heard that it was pressing on your optic nerves, surrounding your carotid artery, hearing all that, how overwhelming was that? And what was your reaction at that point?
I think I was really in shock, and the reason being, I had as soon as I got my IGF-1 levels, I jumped into the acromegaly community, and had been, hearing other people's stories and touching base with people. And when I saw my images and I read the report, my tumor at its greatest length was 6.5 centimeters. Anything over 1 centimeter is considered a macroadenoma. So I had exceeded that, and I had posted my images on the acromegaly group, and the responses, in a very funny way, were not comforting. It was like, I don't know how you're walking. Mine was 1 centimeter, and couldn't function with migraines. Um, and so I think that there was a lot of processing that happened slowly. I'm not a panicker, something that makes me good at my job, and I think good in my relationships is that I'm pretty steady in a crisis. And it's something I definitely pride myself on. So there was a long pause, a lot of time to process. And then it was all about getting understanding, getting information. I think early on, once I got home and was gearing up for surgery and treatment, something I've said multiple times is knowledge is power, knowledge is power. And so I wanted to be as informed as possible. So I think hearing about and seeing my tumor felt a lot like a call to action. Like, what do we have to do? What are the next steps? What information can I collect about my treatment moving forward?
Think if I looked up informed patient in the dictionary, there would be a picture of you next to it. You made sure that you informed yourself. You just mentioned knowledge is power, and knowledge is certainly power. And Callie, you have it. Tell us about your first pituitary surgery and what that experience was like.
Yeah, so we're recording this on May 26th, and I had my surgery about 3 months ago. February 24th, I had my first surgery. We connected with neurosurgery at UT Health, which is kind of our gold standard in this area. It's where my grandfather, my papa, was the vice chairman of pediatrics. My dad went to nursing school there. My aunt, my cousin. We have a great relationship with UT Health. And so went ahead and had my referral sent there right away. They informed me that a surgeon at UT Health would be taking my case, and he specialized in skull-based surgeries along with other things. So we got the ball rolling as quick as we could. I think I had in my head I wanted to get back by August. I wanted to be back to work. I have a very hard time sitting still and feeling disconnected from meaning and purpose and things like that. So I was a little bit focused on a timeline. So we went ahead and had surgery February 24th. And the immediate response after surgery was that it was excellent. They were able to be very aggressive. I may not need radiation. And then I went for my 6-week follow up. And I actually went alone because we were anticipating it being just as simple. I need to make sure I'm cleared for physical therapy. And it was not a simple follow up. We looked at my images, and it was very clear just looking at it that we needed a second surgery. Um, so there was talk of that, starting meds before to see if it would shrink the tumor. And then I had pointed out that what was left was somebody else's macroadenoma. So from a hormonal standpoint, I was not noticing a significant change. I had a rapid decrease in swelling in my face and joints following surgery, and it's come back up. Um, and so I'm in a very similar place that I was before the first surgery, which has been frustrating. It's taken a lot of talking through it with my family, with my friends who are a huge lifeline to me also. They'll let me say the same thing 6 times and never get tired of me, and they remind me how much I'm going through when I get frustrated with myself. Um, but so we were in standby of what's gonna be the next step, and we have plans now, which is wonderful. We, got in contact with Stanford, Dr. Juan Carlos Fernandez Miranda, who everyone says is the guy in the acromegaly group, and we've heard nothing but good things about him and his whole team. We got a second opinion visit with him, and he proposed not 1, but 2 more surgeries. So we're scheduled for July 13th or July 16th to travel to California, and I'll be getting the endonasal approach the same way. So they'll be going through my nose again. And they'll also be doing a bicoronal craniotomy, where they'll cut across the top of my head and then they'll access through my forehead to get to the tumor that is lateral to the carotid artery, and has invaded some of the bone in my skull base.
That is the reason we'll be doing a part 2 and having a conversation after surgery. I'll be patiently waiting to hear information regarding your surgery, your family, your mom. I'm very thankful for actually kept me abreast during your first surgery. You know, you are near and dear to my heart. You are one of my acromegaly little sisters that I have a great relationship with, and I'm thankful for you, and my prayers are with you. Let me ask you this. How does preparing for these 2 additional surgeries differ emotionally from preparing for the first surgery?
Yeah, that's such a good question because it is so, so different knowing what I know now going in for another surgery. Something they were very clear about at Stanford, something I really, really liked when I met with that team is they were reassuring that we had found the right place, which was awesome. And then they also were very clear about uh, what to expect as far as recovery may look different and be more challenging, not just because of the 2 surgeries, but just every surgery in the same area can be a little bit more traumatizing with scar tissue, and they took the time to explain that to me. I think when I realized after my follow-up that I was gonna need an additional surgery before I knew it was the 2, I I was angry, I was upset. I think there was for the first time, there was some anxiety and fear, not the first time, but more prominent, and it was kind of leading my days for a while of I knew how uncomfortable the recovery was for me the first time. I knew how uncomfortable the debridements have been for me. Uh, so having done surgery and then 3 months later realizing we're doing it again and it may be a little bit more rough, that has been something I've had to mentally come to terms with. And I was speaking to my therapist who is just she's been a huge resource. If anybody can find somebody who specializes in working with patients, that is what I would recommend. But I just said I hit a point where it was no longer productive for my healing to be upset. It was no longer productive for me to feel anxious and scared. I had to get with the program. I had to wrap my head around it and get back in this space of it's go time. Let's tackle this. What do I need to do? So I definitely feel more prepared for the post-op healing and the things that I'm going to bring and um, what are comfort items for me. But I'm anticipating some variation in overall pain levels, discomfort, and every hospital system does it differently. So I'm ready for those things and as prepared as I can be, hopefully.
Got to give a shout out to Dr. JFM, who's already been a guest here on the podcast with me. I was fortunate enough recently to spend some time out with him and his team at the Stanford Pituitary Patient Day meeting, where I had a phenomenal time. I was able to speak with other patients with pituitary disorders, meet a lot of the staff that you've now met at Stanford. And that's a great team and a great group of people to be associated with. Callie, what is it like facing multiple serious diagnoses at such a young age? You're only 28 and you've got a lot to deal with. I'm so happy you have a therapist that you've mentioned a few times here, but tell us how it's been for you getting through this.
I think that the first diagnosis, well, the PCOS, I think it's so common and, there's other people to talk to and you have some resources. So that felt a little less significant at the time. Um, and then the cancer, I was battling the same cancer that my mom had. I knew that there was a really good chance at a good outcome. Um, and those blood work, body scans all just become routine. The acromegaly and diabetes diagnosis have made me realize how much the other diagnoses sped up how I've grown up. I think my 20s, I'm 28, I think my 20s have been very formative. And I think a big part of my outlook on life, the things that I'm grateful for, the things that I choose to prioritize are because I know what it is to not be healthy. And I think that 5-year window after my cancer treatment, I had a feeling, just a gut feeling that I would be a patient again. And so I really think, as hard as it is, there have been so many beautiful things and beautiful moments and connection pieces that have come out of these hard things that I've been through. Um, I was explaining it to one of my friends, and I just said, when you're sick, you're more awake than you've ever been. You're more locked in to the people that you have around you and the little joys that you can pull out of life because things are hard right now, but at least I have mint chocolate chip ice cream from Bluebell, you know? And so I think that I like what my illnesses have made me out to be. I like the woman that I am. Um, and it's also been really hard. And I've really been working on creating space for both things that I can feel confident that I'll get through this and I can feel strong and able. And I can feel exhausted and worn out, you know, and I'm very lucky that I have the people in my life that will let me cry on their couch and let me dance in their kitchen with them. So, um, yeah, I think that it's just been so formative to have gone through these things.
Callie, you are strong and able, and you can definitely dance in my kitchen whenever you're ready. What would let's switch gears back to work because this is a spot where other people struggle with. What would you say to others who feel guilty about stepping away from work to prioritize their health and their well-being?
Yeah, something that's actually really helped me is something that our friend Megan Ryan's husband Scott said is better is not well. And so, something that was really prominent after my diagnosis is they call it post-diagnosis hypervigilance. And I looked it up because I was like, I'm crazy. Like, I have to be. And I wasn't aware of how much pain I was in until I was diagnosed. And then I was just wiped out. There's so much because these symptoms are slow onset for us, we get used to ignoring it. And your brain disconnects from those pain pathways and it focuses on something else because it's not productive to focus on the pain that it's constantly in. And so, um, I actually also spoke with a professor I had in undergrad who is a pain scientist and really like I called her because I was like, I need someone to tell me I'm not crazy. Um, so I think just because you've been doing a job before you're diagnosed doesn't mean that that's the best thing for you to be doing while you're getting treatment for a pituitary tumor, right? Like, I think because it's not visible to a lot of people and because these changes are slow onset, we feel like they're not as valid as a more acute injury or illness, maybe. And that's just not the case. I'm in a little bit of a different situation because of the physicality of my job, but I also know people who have desk jobs who can't function the same way due to this diagnosis and who need to take more days and things like that. And so I just, you're going to hear so many times that it's okay to be selfish and it's okay to take care of yourself. And you're going to hear it and not sink in. But let this be like the 100th time you hear it and really know it's okay to take care of yourself. It's okay to prioritize getting healthy over being productive at work if you have the ability to do that.
Something else that I think is important to say, or touch on for that matter. You have your parents, your sisters, and your friends who I know have supported you through this all the way. You've got a remarkable family. What advice would you give others who are supporting a friend or a family member living with acromegaly or going through a similar situation that you've been going through?
Yeah, I mean, the the best thing I could say is just be present. Be present and meet them where they're at each day. So, I mean, when I was diagnosed with my thyroid cancer, one of my friends, Jordan, took me axe throwing to get my anger out. And um, I've gone and sat on my friend since we were 8, Danny, sat on her couch and she just feeds me. And I just sit and we do PJs all day. And I mean, I have friends in Virginia who put all my big appointments on their calendar. My friend Lindsay sent me a box of affirmations for me to look at each day. It's things like that where it's just being present, has made all the difference. Knowing that I'm getting a text that's checking in, knowing that I could get on a plane and fly to California and be with Jen, and she would have a spot for me in her house. So I think the best thing you can do is just be more vocal about check-ins, physically be there, just make time, set aside time for the person going through this, and remind them that it is okay to feel however they need to feel. There have been some really, really hard days where all I needed was to just have a good cry and eat something that my mom was gonna cook for me because everything she touches is magic. So, it's just stuff like that, just be there. There's not always an actionable step, there's not always a right thing to say, but knowing that I have people I could call to go to appointments with me if I needed, and knowing that I could go stay the night in Austin with my friend Brianna, there's just so many things that, um even if you're not accessing them all the time, knowing that they exist in this world and knowing that these people who really just want what's best for me exist has helped me feel confident moving forward. If I were doing it by myself, I know that I would not feel as confident and sure.
The fact that you aren't doing it by yourself leads me to my next question. How important has the acromegaly community been in helping you feel understood and supported? What did it mean to connect with people who truly get it?
Yeah, so initially, looking at the group, I connected with you and Jill, just sent a message introducing myself, and um, because you guys definitely do a lot of work out and about and going to conferences, and so that was a huge contact, and you connected me with, my girl group, Lauren, Angela, and Megan, and that has been so important, because acromegaly is so rare, you don't have access locally very often to people going through the same thing or who, you know, being a 20-something female, 30-something female, having other women going through acromegaly, um, has been huge. So, just getting to, like, send off a text about a symptom I'm having and not feel like no one's gonna understand this, knowing that it's met with a true empathy and understanding, has made all the difference. I met Avery through your podcast you had done with her. There was so much she had said that just really hit home for me. And so we've exchanged some voice messages and texts, and it's just, um, it removes some of that isolation that you feel, even when you have great people around. It's very isolating to be the patient at times, especially with a rare disorder. So yeah, the connection has been huge.
The acromegaly community has certainly been a saving grace for me. I wouldn't be here doing this podcast without that phenomenal group of people. You've got two upcoming surgeries. What are your biggest hopes for life after surgery?
Um, I think I want to know what normal feels like. And I don't say that in like I'm a freak kind of way. I say it in my tumor has likely been growing since I was 19 years old, is what every doctor has told me, 19 or 18 years old. Um, and so really, I have not lived as an adult in a healthy body. And so I'm really curious to see what good energy feels like and what a lack of swelling feels like. Um, I think I've been able to accomplish a lot, and I'm grateful for the last decade. But I'm curious to see what I can do when I'm not having my body work against me most days.
You have been extremely productive thus far. You're a woman who's in her career. You're working on your master's. You have a tremendous road ahead of you.
Thank you.
I'm extremely proud of what you already done.
Thank you.
You're very welcome. If someone has just been diagnosed with acromegaly, and feels terrified, what would you want them to know right now?
I think I would double down on finding a good primary care endocrinologist who's working side by side with you, who's not threatened by you doing your own research, who is willing to listen. I think that's a great sign. If you say, I found this article or I read online and they don't push back on you immediately, I think that's a very good sign that you have found someone who's cooperative and open to the patient also being the expert on the disease. I would say find community, get plugged in with the Facebook group, find your uh, one or two people who have similar experiences. Um, get a group text going and have that community and be plugged into your community at home with your family and friends. We hear it all the time. It's okay to feel however you want to feel. I've had moments where I'm with someone and they're like, well, what do you need? And the answer is, I just need to feel sorry for myself for a day. I need to give myself a day because we power through and we're used to powering through. And if you need a day to have a bad attitude once a month, you are entitled to that, right? Work on moving forward in a positive, grateful way. But this is hard, and anybody who tells you it's not hard isn't going through it. Um, so give yourself space and let others give you space to feel exactly how you need to feel.
Phenomenal advice. Callie, we're at the point in this conversation where I want you to finish this sentence. Are you ready?
I'm ready.
As I prepare for my second pituitary surgery, what I've learned from this entire experience is
It's all living. I think even when things are really hard, there's stuff to be grateful for. And um, for instance, so this past Tuesdays when I met with Dr. JFM and we had this appointment, and me and my parents are a little caught off guard by the craniotomy piece. I immediately get in my car and go to physical therapy, and from there, I immediately go to the hospital and I get to watch my niece be born. So I think it feels like an interruption to life to be sick, but if you really pay attention, life is going on around you. It may be disruptive to your work and your routine, but there are things that can come out of being sick and being an acromegaly patient that are gifts, and it's all in perspective.
you have two new additions to the family. Can
Yeah.
you tell us about that?
Yeah. So I'm one of four girls. I have three sisters, and we're very close, Meg, Alex, and Erin. And Meg and Alex both had girls this week. They had girls on the same day 2 years ago, and just had another set of girls. So we call them the Umbel twins, even though they're not twins. I have six nieces now and a nephew. And Aunt Judy has been giving me a lot of purpose and meaning on the days that I'm feeling good. It's been very, very comforting to be plugged back in with my family in Texas. I could not imagine doing this away from them.
Callie, your story is one of the most powerful examples of courage, intelligence, and resilience that I've ever had the privilege to share on this platform. At just 28 years old, you face acromegaly, diabetes, thyroid cancer, and countless moments of uncertainty, and yet you are here choosing to use your experience to help others. That, Callie, is extraordinary. You've shown us what it means to become your own advocate. You've shown us the importance of asking questions. You've shown us how much it matters to have a doctor who listens. You've shown us that even when life feels overwhelming, there is still strength to be found. That is your impact. That is your legacy. And that, my friend, is bigger than you may ever realize. Thank you for your courage, your vulnerability, and your heart. I will be anxiously waiting for part two with you post-surgery blessings to you and yours. If Cali's story has moved you, inspired you, or helped you feel less alone, make sure to support the channel. You can hit that subscribe button, like this video, share it with others, and leave a comment below. You can also follow me on all my social media platforms and stay right here for more real conversations, expert insight, and inspiring stories. Cali, I want to thank you for your time. I want to thank you for joining me today. Most importantly, Cali, I want to thank you for talking acromegaly and pituitary with Tony. It's been a pleasure having you today.
Thank you so much, Tony. So much of my knowledge and understanding has come from the work that you're doing. And Tony Alston is a household name at this point in the Umbel household. We're very, very grateful.
Thank you. Thank you so much. Good people, if you're ready for another powerful conversation with someone else who lives with acromegaly, click here and check out my conversation with Megan Ryan, someone who is dear to both Cali and I. Thanks for watching.